Welcome to practice. Practice is acronym for proper routine and clinical techniques in clinical excellence. This channel is dedicated to empowering healthcare professionals and students in medical laboratory, medicine, in nursing, pharmacy, and clinical research. Through concise, practical, and clinically relevant videos, we cover essential topics like avoiding common clinical errors, diagnostic techniques, and general best clinical practices. Whether you are a student building your skills or a seasoned professional refreshing your knowledge, practice is your trusted resource for mastering clinical excellence. Stay tuned. Learn something new. Take your practice to the next level. Now, don't forget to like, share, and subscribe to support the journey of clinical excellence. Ready to level up? Let's get started. Phlebotomy is the process of drawing blood from the circulatory system in order to obtain sample for analysis and diagnosis. Phlebotomy is indispensable in healthcare, serving as cornerstone for diagnostic, for therapeutic, and for research activities. Therefore, its proper execution is essential in ensuring that, first of all, patient safety is guaranteed. 2. Diagnostic reliability is assured in overall healthcare efficiency, making it a fundamental skill in clinical practice. Why is it important that we carry out proper phlebotomy procedure? First of all, it ensures good sample integrity, it ensures accuracy in our test results, it reduces pre-analytical errors, it ensures patient safety and comfort, it supports effective diagnosis and treatment, and above all, it reflects competency and credibility. The procedure. First, ensure that you have all materials needed for the procedure. Approach the patient in a friendly, calm manner. Introduce yourself to the patient and gain his or her consent and cooperation. 3. Check to ensure this is the right patient for the test to be done. Properly fill out appropriate requisition forms indicating the tests that have been ordered. Verify the patient's condition, fasting, dietary restrictions, medications, timing, and medical treatment are of concern depending on the test to be done and should be noted on the lab requisition form. It will be good to ask the patient if he is allergic to any antiseptics, adhesives, or latex which you'll be using on him or her. Apply the tourniquet 5 to 7 centimeters above the selected puncture site. Do not place too tightly or leave it on for more than 1 minute. If tourniquet stays on longer than required, release it and wait about 2 minutes before reapplying the tourniquet. The patient should make a fist without pumping the hand to make the vein more prominent. Select the Venipuncture site. Prepare the patient's arm using an alcohol prep. Disinfect the site in a circular fashion, beginning at the target site and moving outward. Allow to air dry. Do not touch the clean site when entering the vein. If accidentally touched, do the disinfection once again. Now, grab the patient's arm firmly using your thumb to draw the skin taut and anchor the vein. The needle should form a 15 to 30 degrees angle with the surface of the arm. Then, swiftly insert the needle through the skin and into the lumen of the vein. When the last tube to be drawn is filling, release the tourniquet. Withdraw the needle gently and apply gentle pressure to the site with a clean, dry cotton wool. Ask the patient to hold the cotton wool in place with the arm extended and raised. Ask the patient not to bend the arm because doing so can cause hematoma. Ask the patient to continue to press it firmly for at least 2 minutes, after which phlebotomy plaster can be applied to reduce the risk of infection at the punctured site. Here, consistent firm pressure is essential to reduce the risk of hematoma forming or prolonging the bleeding. Dispose of contaminated materials in a designated container. Mix and label all appropriate tubes at the patient's side while the patient is still with you. Ensure the patient is feeling okay after the procedure. Deliver specimen promptly to the laboratory for processing and then perform hand hygiene. What's your approach? Don't forget to comment, like, share, and subscribe.